So good evening. My name is Dr. Kenesha Zimmerman. I'm an associate professor of pediatrics at Duke University, specializing in pediatric critical care medicine. I'm also co-chair of the Scientific Advisory Board for Schools. I'm here with my co-chair, Dr. Danny Benjamin, who is Distinguished Professor of Pediatrics, who specializes in pediatric infectious diseases as well as epidemiology. On behalf of the Scientific Advisory Board for Schools, we are pleased to welcome you to the COVID-19 in the Classroom webinar series. We're very excited to spend the next several months with you talking about COVID-19, answering your questions, and really making sure that we can all be safe moving forward. Next slide, please. Next slide, please. We know that COVID-19 has had a significant impact on people's lives and on our communities. It has upended the way that we do basic things. It's made us question what we can do and what we should do moving forward. This is no different for schools. It's caused a significant dilemma for us. We know that there's concern about asymptomatic spread among school-age children and what that means for children and for their teachers and for their parents and for our community at large. We also know that school is fundamentally good. There's evidence of significant social, emotional, and educational burden from delaying return to in-person school. These are a lot of questions. There's a lot of concern. With these in mind, next slide, please. With these in mind, my colleagues and I created the Scientific Advisory Board. We know that you're thinking about a lot of things and have a lot of needs at this point, and that we can only feel just a little niche. However, we want to make sure that people have the right information. We want to give a data-driven approach to help support leaders who are making decisions about our children and about our community. We want to make sure that we can do things safely. The Scientific Advisory Board has a three-tiered approach. We want to provide educational outreach, and that's why we're all here today. We also want to make sure that we have the up-to-date data, specific data, so we can make specific decisions about our school districts and about our specific children. We want to make sure that we can share that information with others so they can learn from our lessons and learn from our successes. Next slide, please. I'd be remiss if I did not describe to you and tell you about my colleagues in this endeavor. Dr. Akinboyo is an assistant professor of pediatrics at Duke University. She's head of pediatric infection control. Dr. Gabriela Maradiaga-Panioti is an assistant professor of pediatrics at Duke as well. She's a primary care physician. Dr. Mickey Cohen-Wolkowitz is a distinguished professor of infectious diseases at Duke University, and Dr. David Weber is a medical director of UNC's infection prevention program and also the associate chief medical officer at UNC Healthcare. Next slide, please. I'll turn it over to my colleague and co-chair, Dr. Danny Benjamin, to move us forward. Danny?
Great. Thanks, Kenesha. So the format for tonight's session and for many of the sessions moving forward in the educational series will be a question and answer format. Our colleagues who are on the expert panel will provide several slides. They've shown them to us and to the other team members. Those slides are based on the questions that the teachers, the staff members, and the superintendents from the school districts that are participating in the program have given to us. We'll then go through a question and answer period where questions that have come up from teachers and staff throughout the school districts are asked of our panelists. And please feel free to ask clarifying questions or additional questions that come to mind in the chat. The questions that are in the chat will either be asked in a future webinar, will be addressed in writing, or if especially needed for clarification tonight, and if we have time, we'll address them tonight. So please feel free to put those questions into the chat, and you can address them either to one of the project leaders, for example, Helen Bristow specifically, or you can contact us at Duke specifically if you have additional questions that you'd like to see in the future or work through your school leadership. And with that, I think the first set of slides belongs to Dr. Akinboyo tonight. Ibakan, if you'd take it from here, please.
Thank you, Danny, for the opportunity to speak today, and also all of our colleagues on here. It is a joint effort, but I will lead off just describing the basic components, which I think everyone knows about COVID-19 and the virus that causes COVID-19. Could we go to the next slide, please? So I think, again, making sure we're starting up on the same page. Some of this may be repetitive, but the question comes up, what's SARS-CoV-2 and what's COVID-19? So colloquially, we name viruses based on where they're found or based on specific criteria about what is in their DNA or RNA. In this case, the severe acute respiratory syndrome coronavirus 2 is SARS-CoV-2, and that's the virus that causes coronavirus disease, which has been named COVID-19, and we will call COVID or COVID-19 as we go through the presentation. I think it's good to kind of understand the pattern of what coronaviruses do. So historically, we know that they have jumped through species and jumped from animals and caused disease in humans. This is the third to do it in the last 17 years. You may have heard of some of the others, one of them being SARS-CoV-1 back in 2003, and another one commonly known as MERS, or Middle East Respiratory Syndrome. All of that to say, those are the ones that cross species and cause severe disease in humans. But we have a number of coronaviruses that continue to circulate and have circulated in the United States each respiratory season. There are at least 4 of them that we know about. And as we approach the upcoming respiratory season, some tests that you do for respiratory viruses might actually find this commonly spread coronaviruses. So I don't want people to be alarmed. There's COVID-19 and there's the virus that causes that, but a test might find the common coronavirus, and it's important to talk to your provider to iron out which one you're finding if you get tested. Next slide.
So Dr. Akinboye, how does COVID-19 spread, and why do we need face coverings if case counts are decreasing?
Good question. I think it's nice to be in a place where we're talking about decreasing case counts, particularly in Durham, where we're based at Duke, and also just in general in the United States. It does seem we're seeing a slight trend downwards. However, we're still seeing a large amount of coronavirus spread, and we'll talk a little bit more about this in the next few slides. But we all know that the most significant way of spread is through coughing and sneezing. Next, here. And also the ways to prevent this includes wearing a mask, the main focus of our chat today, physical distancing, and washing hands. Next slide. The important point here, there've been a lot of confusing messages about what to do with groceries, what to do with what you touch, and what happens with the environment. But I think the important point here is the main form of spread is person-to-person transmission. And that's when an infected person releases some droplets, coughing and sneezing being the most common, lands in someone else's mouth and nose. It's a kind of gross graphic, but it makes the point very well. Or it's inhaled, which I think is fairly common if you're in close distance. So distance matters a lot. We've talked a lot about 6 feet. Important to remember, it's kind of all on a spectrum. If you can stand 10 feet away, you should. But if you're within 6 feet, then there's a higher risk of spread. There is also a small chance that if someone coughs or sneezes, they can contaminate their immediate environment, and someone else can touch that immediate environment and potentially get or catch COVID-19. But I think this is a much lower chance, a lower risk, and we will have a dedicated webinar focusing on what to do with the environment, so I won't belabor the point here today. And finally, we talk a lot about infected people. So we see someone coughing and sneezing, and we know that they're infected and they're transmitting the virus. One of the reasons why we had to throw out all of our playbook around COVID-19 is the fact that asymptomatic people can also spread the virus through the exact same mechanisms. And this explains some of the confusion around wearing masks earlier on this year. We do not typically recommend any form of mask wearing for people that don't have symptoms. We've hardly ever done that in any setting. But as we learned about COVID-19 and realized that one of the key groups that happen to spread this virus are those that do not have any symptoms, we shifted. I think the medical community, and particularly the CDC, shifted to start to recommend face coverings for all of those that are in the community to help us reduce spread. Next slide. So there's some other factors. We will talk some more about masking, but we can't lose sight of some of the other factors that impact how and why COVID-19 spreads. As I mentioned, everything is on a spectrum. So the duration or the nature of your contact with someone that's infected. So for example, if you spend 10 minutes as compared to 20 minutes as compared to an hour, it may impact if and how COVID-19 may spread in that setting. The number of people that happen to be in a closed, confined space certainly matters a lot, particularly if they happen to be infected, and how people comply or adhere to prevention practices. And this is not just masking, which is our focus, but it includes hand washing and how we clean the environment, and not forgetting to stay home and stay away from people if you're sick. Next slide. We have a few slides coming up, which I'll walk through slowly, that just talk about the importance of masking and face coverings. We have multiple opportunities for questions, so if these raise questions or they're confusing, please feel free to put a question in the Q&A, and we can address it either here or at a subsequent webinar. So let's just start off with two people. So it's the same person who's infected. One person is without a mask, the other person is with a mask. And this is accounting for how we regularly speak, how we breathe, and how just air moves around our faces or within the environment. The person should be on your screen to the left is speaking, and you can see respiratory droplets just kind of being released out into the immediate environment. By wearing a mask, even if some of those droplets leak around the side, most of the respiratory droplets are caught in the mask, and it limits the contamination in the immediate environment. So it just limits the number of drops, so think of raindrops that are hanging around in the environment that are likely to infect someone else in that space. Next slide. So keeping in mind, if you have, so now we still have the infected person that's staying in the environment, just talking, maybe coughing, maybe sneezing, releasing those droplets in. An uninfected person, particularly if you're within 6 feet, can breathe in what's in their immediate environment. As you can see, those arrows just going right into the mouth and nose. And this is just part of routine air movement and breathing, and taking those droplets as they release them. Next slide. So let's imagine that infected person is wearing a mask. As I mentioned previously, most of the droplets should be caught within the face covering or mask. There may be a little that seep through, but distancing should help with reducing the chance that an uninfected person, the one to my right, that's within that space, gets infected. Keeping in mind that how we typically move air in and out involves moving things within our immediate environment in as we breathe in, and air moving around our faces. So this should lower the risk of transmission in this case. Next slide, please. This is the ideal state. So even if the infected person is wearing a mask, and that might lower your risk if you're not wearing a mask, you reduce that even further if both people are wearing a mask. So the infected person, most of the respiratory droplets are caught within the facial covering or mask, and the uninfected person still taking in air, as we all do, from our immediate environment, but the face covering provides just an immediate barrier and may limit the amount of infected respiratory droplets you breathe in. Not forgetting that space is also important, because the further out you go, the more likely the droplets actually just drop to the floor, and the tiny aerosols that spread out through may not reach you the further out you are. Next slide, please. And so bringing this all home, so we can talk about theory, we can talk about what happens when you're wearing a face covering, maybe when you're in a lab, and what we expect with air movement and how respiratory droplets move. But realistically, we've had time to report on cases where people have been exposed in pretty close settings, such as in this report from the CDC. This report reviews 2 hairstylists who had COVID-19. They were unfortunately diagnosed after they had spent at least 15 minutes with over 100, so about 139 different clients. And anyone that has been getting their hair done knows how closely you interact with your hairstylist. Everyone wore a face covering. And in this case, it seemed there were mostly fabric masks that were worn. I'm sure some customers may have had a surgical mask, but the bulk of them were wearing fabric masks. And with the dedicated tracing, it wasn't every single client, but most clients that met the exposure criteria, none of them were known to be infected at the conclusion of this tracing. And so wearing cloth face coverings consistently and correctly, which we'll talk about in a few slides, can help to slow down the spread and can reduce the risk of infection. Next slide. So in summary, let's kind of go through what we talked about in the last couple of slides. So why should anyone wear a mask or face covering? I think we know, based on prior data, even before the pandemic, and certainly during the pandemic, wearing a face covering can prevent you from spreading viruses. And to an extent, wearing a face covering can actually prevent you from getting viruses. Just kind of keep in mind the pictures we reviewed where an infected person stands on one side and an uninfected person stands on the other side. Another thing about COVID-19 that's quite unique is the fact that asymptomatic people can spread. And since they can spread, it's safer for everyone to have a mask or face covering on, since we can't use our typical ways of identifying people that are symptomatic. Not everyone will be obviously coughing and sneezing in the moment, but they're able to be infected and spread the virus. And going back to the hairstylist example, that's just a real life situation where someone interacted with multiple people in pretty close settings. And by wearing face coverings, we know that they decrease their chance of infecting, and they could not even identify anyone that was infected from that exposure. Next slide.
So I think this question is really appropriate for our general pediatrician on the panel. That's Dr. Maradiaga Penayotti. And Gabby, this, I think, question came in from quite a few elementary school teachers in particular across the region, and that is, will children wear masks, especially younger children in the K through third grade environment? Can you comment on that based on your experience?
Sure, you're absolutely right. This question comes up all the time. So I'll share with you that in our clinic, we see over 200 pediatric patients a day. They are all comers from different insurance types, demographics, and backgrounds. And we have hardly had any problems with the children keeping their masks on. In fact, it's often the parents and some of the older kids that need the frequent reminders. Of course, this audience, you are all experts in child development, right? And you know how important routine, consistency, and role modeling are to help children thrive. These are essential components of work with children. So if the children know what to expect and when to expect it, and it's the same message every day from every person, success is more likely. And we've seen that firsthand in our clinic. Everybody knows you put on a mask when you come in, you wear it in the clinic, you keep it on, and you leave. Kind of like lunchtime. Lunchtime is the same time every day. Children know when it's going to happen. They know when to expect it. They know when lunchtime is. So I'll say the same for masks. If children learn to understand that this is how school is going to function, that the rules are the same in every classroom, with every instructor, every single day, and the exceptions are few and far between, they will comply very well. So re-emphasizing the point, I think actually younger children will do very well. I had one patient today. She's a sweet 10-year-old girl, and she has a genetic condition that requires her to have a breathing tube in her throat. She has delays, and you know what? She wore a mask, and she was fine. So we see a broad range of kids that can wear masks well, and I think goes back to, again, the routine, the consistency, and role modeling.
Great, thanks. And I think we're seeing that across the system as well. Next slide, please.
So Dr. Akinboyo, we've recently gotten recommendations from the Department of Health and Human Services about recommending mask breaks, particularly in school. So how can you safely facilitate a mask break?
Thank you. Another good question. So going back to what we talked about in terms of what are the factors that impact COVID-19, I'll bring it back to this question and see if we can address this. So I mentioned the duration and nature of contact. So what does that mean? I like what was referred to previously, where we have to ensure that there's some consistency with everything we're doing, really with kids in general, but particularly around COVID-19 management. And I think in this context, ensuring that the length of time that you provide for mask breaks are focused and short, relatively short. Oftentimes we'll use 15 minutes to describe an exposure, so that can be one suggestion, and timing that so people know when to expect it, they can wait for it, and they can take that break for the duration you provide. Going back to, again, the comment about number of people in a confined space, it's important to try to take mask breaks when you can outdoors. If it has to be indoors, try and incorporate all of the other prevention practices. So every other time, people should be wearing their mask as consistently as possible. And when you are ready to take a break, they should be separated, 6 feet being the distance that I think can keep people far enough away to prevent spread from just talking. I think I would discourage shouting and singing with the mask off, because we know that leads to increased droplets. Just you've seen those videos where someone's shouting or singing and you're just spewing into the air. So just trying to be practical, knowing that some kids will get tired, adults get tired. We have to wear masks all day, every day at work. And people just try to take their lunch break outdoors. So keeping it short, keeping it focused. When you're actually wearing the mask, making sure you're doing it properly, and keeping some distance when the mask is off. And of course, washing your hands before you take the mask off and right after. Next slide.
Great. And I think the next question comes from several teachers in Orange County. Is Dr. Reiser or Dr. Rocker available?
Yeah, yes, we are. Are there specific circumstances in which a face shield is recommended?
And I believe this one goes to, is this Dr. Akinboyo again, or does this belong to Dr. Weber? Dr. Weber had some points on this the other night, I believe.
That's
Yes,
correct.
I'm happy to answer this question
Thank you.
if you would like.
That'd be great, thanks.
So face shields are certainly useful for protecting, importantly, mouth, nose, and eyes, which can, particularly the eyes, which if they get respiratory droplets in them at a close distance can lead to infection. So the time they would be most useful would be by a school nurse who's, getting a swab for COVID or a throat culture there. But in general, I should say, importantly, a face shield is not needed and not recommended in general. What is recommended is a mask, as we talked about, or a face covering. And importantly, a face shield is not a substitute for wearing a mask. So if a face shield is used, like by the school nurse, then you still need to wear a mask under it. And that's because, as you can see from the shield here, they have wide openings at the bottom, on the sides, and in the top. And we don't know if that would be adequate to protect you against very small respiratory droplets, whereas the mask is directly, or the face shield directly over the mouth and nose, and filtering those particles from entering the lungs. Research is being done to decide whether a shield could be used alone, but there's no data to suggest it by itself is successful.
Thank you. Next slide, please.
Can staff remove masks while actively instructing?
Dr. Weber, would you like to take that question as well?
Yes, I'll be happy to do that. I think in general, the teacher should wear, the staff, the mask all times. That's in part to send the right message to the children who are watching that mask use is imperative. That said and done, I know certainly being able to see someone's lips is important. I should say we are developing masks that are translucent or transparent, or have a transparent piece, so that we will be able to, in the next few months, I think, move to well-defined masks and face coverings that children will still provide protection. Children could see your mask. But if you need to, the answer is, as long as you are at least 6 feet, and probably ideally a little more, away from a person, not shouting, screaming, playing instruments, you could remove a mask while actively doing instruction if the children are having trouble hearing you or seeing your lips. But ideally, you would keep the mask on at all times to send the right message to the children.
Thank you. Next slide.
Great. From Durham County, we had a couple. Thank you.
Here's the question for us. Do cloth masks have to be washed every day? Would they lose their effectiveness if washed or not washed daily?
Thank you. Dr. Akinboyo, can you comment on this?
Yes, thank you. So it's a question that comes up quite often. I think the CDC and our local and state health department have recommended washing after every use. So practically speaking, I think what that means is if you have a school day, for example, and you wear a fabric mask all day, most people have allotted a mask per day, so you don't have to run your machine every single day. But the idea is you're changing that mask every day, and you should wash it after you've used it all day. So if you wash it consistently for a mask that's well made, that still has maintained its integrity, so it doesn't have holes, it's not torn, it's not frayed, and it can still cover your mouth and nose and chin, which we'll talk about as we move on, I don't think a typical mask will lose its effectiveness if it's washed frequently. Of course, as with clothing, if it starts to become a little too pliable, just make sure you're looking at the mask and making sure it's still workable, especially for fabric masks. But people that are asking questions around not washing it to maintain its integrity, I think the concern there is not so much about the integrity of the mask, but really about the fact that you're using it to protect from getting droplets, and it may be contaminated after you've used it. So you don't want to then put that back on your face the next day, assuming that you were exposed to someone the day prior or something like that. So I think it's just important to assume that, particularly your fabric mask, if you're using it for a number of hours, it's a one-time use and you just kind of wash it. Just get in the routine of washing it after every use, particularly after daily use if you're using it all day. If it's disposable, then as you can imagine, usually throwing it away. We usually do that at the end of our work day. So at the end of the day, you just kind of throw it away.
Great. So just to clarify, when we're in the hospital setting, we use our mask for one day and then we're done with it if it's disposable. And for some of our patients, we encourage washing if they're using fabric. Is that correct?
That's correct. So in the hospital setting, a mask that's not the N95, and we'll talk about the different masks in a few slides, we use it for the whole day and we dispose of it at the end. For patients, if they're wearing a fabric mask, we often encourage them to try and change that out every so often. I don't know that it's done daily, but that's also partially because they only use it when they're interacting with staff members who are also masked. Did that address that question?
Yeah, that's great. Thank you. Next slide.
I think this also was a slide included to ensure we talk about things to avoid. What we've noticed, and I'm sure you've seen this as well, I think people are doing their very best to ensure they're wearing a face covering, but there's a lot of manipulation of the mask, and that just defeats the purpose. You really want to avoid touching the mask too frequently, or if you do have to adjust your mask, particularly if you're talking and it slips up and down, just ensuring you get in the habit of washing your hands right afterwards. So if the mask is contaminated, you're not using your hand to touch other things and contaminate surfaces. Oftentimes the masks that have exhalation valves, so I don't have a picture of it on here, but they're those that almost have it looks like a vent that you can turn open, essentially defeats the purpose again of a face covering, because it releases air into the immediate environment. And what we're trying to do is avoid that from happening. So especially in closed settings where you're working closely with children, I think it's important to probably limit the use or avoid the use of a mask that has an exhalation valve if that's what you have access to. And as I mentioned with the last slide, it's just important to avoid wearing a mask that's visibly dirty. Recommended washing it after every use or at least daily. And if it doesn't look like it's working well, if it's too soft, it doesn't fit your face, doesn't cover the nose and goes all the way down to the chin appropriately, then it's probably important to switch out the mask if you have options for it. We can do a live mask wearing at some point, but I don't have a fabric mask with me. I have a surgical mask.
Thank you.
All right, I have another question here. Does Plexiglass provide additional protection in addition to wearing a mask?
Dr. Weber, would you like to speak to that?
I would indeed. So the answer is there's not good scientific data yet on plexiglass, but nevertheless, anything that helps separate and contain respiratory droplets is likely to be protective. But again, as you can see from the picture here, the students are quite closely located. A lot will depend on airflow from one student to another, around or above or below the plexiglass. So the current recommendation is, as long as you're within 6 feet of someone else, you should be wearing a mask, even if there is plexiglass between you, unless it's an entirely sealed system, which is really not what we do in education. So these students, even though they have plexiglass around them, should be in masks if they're within 6 feet.
Thank you.
And I think this one is from Wake County.
Good evening. Is there a proper way to wear a mask or face covering?
And Dr. Ackenboy, I think you referenced earlier, you might be giving some more detail on this. Can you pick this one up for us, please?
Yes, I sure can. Next slide, please. So we'll start with what not to do. I think we've seen different versions of this floating around. Just look around in the grocery store for a second and you can see this. But I think the whole point is to have a face covering over the nose, mouth, and down to the chin, because it helps to keep the face covering or mask in place. So for those that, just in the first, starting from the left, that may have a hole to help with eating and drinking, defeats the purpose. Some people have tried to just hang it on the ear or remove it while speaking. Again, it kind of defeats the purpose, particularly if you're within 6 feet. Lots of people have a mask that just covers the mouth. And sometimes that's because the mask is too small. Because as soon as you start to talk, that mask just shifts downwards because your chin moves it downwards. So ensuring that you have a proper fit is important. And if you don't have that, trying to find a larger mask or making one. I think there's so many videos online about how to make one fairly simply or at home. Some of the ones on the bottom are just a reminder that if it's not covering your mouth or your nose, it's really not doing anything. One thing people have asked about, maybe when you're walking outside, if you come into a crowded place, you leave it on your neck so you can just pull it right back up, particularly people that are running or on a trail. It makes some sense. I think there's certain face coverings that are made for that purpose. You have to remember that your neck also can harbor just bacteria in general, and you don't want to necessarily just rub your face with your bacteria back up and down. So it's reasonable to just take it off, and all you have to do is hold it by the loops and take it off and put it on a clean surface and wash your hands and do the exact same thing back. I think the next slide may address this. Next slide, please. All right, so what do you do if you're trying to wear a mask safely? Of course, you should clean your hands before touching your mask, just assuming that you've interacted with your immediate environment. You may have touched something that you're unaware of. With whichever mask you're going to put on your face, make sure it's intact. It doesn't have holes. It covers your mouth, your nose, mouth, and chin. Avoid touching the mask and clean your hands as soon as you take it off. I like the picture in the middle to the right because it shows how you should properly remove it. And the ear loops are very useful for this, kind of just pulling the ear loops out and taking it off. And I have a surgical mask here, but the goal is the blue side is the contaminated side. So you kind of fold it over itself and place it down. And the idea is you keep the exposed side together and place it on a clean surface or in a bag like what they're doing in here. If it's not done perfectly, that's okay. Just as long as you know what to do, and when you can, you do it properly and you wash your hands afterwards. That's really the key point here. Next slide, please.
Should everyone be provided with N95 masks, as they seem to provide the safest protection?
Dr. Weber, can you speak to that?
Absolutely. So an N95, you can see, has better filtering capacity. One, because they are a little tighter fit. You can see the double rubber bands, as well as more efficient filtering through the mask. The downsides of the N95 are they are more difficult to breathe through. They muffle the sounds when you talk more. They're harder to wear for long periods of time. But most importantly, the evidence, although I've talked about filtering capacity, the evidence when you've actually done studies comparing the N95 versus standard mask does not actually show that they are superior for preventing transmission acquisition of viruses such as SARS-1 or MERS. So that really, in most circumstances, except for when we're doing procedures in hospitals that generate a lot of coughing, a mask is just as good in providing protection as an N95. And there are the detriments I said in terms of the N95. The other thing I'll say about N95, masks in general are designed to fit a variety of large and small individuals and facial types. The N95s actually, because they're so tight-fitting, they come in small, medium, large, and in some cases extra large. And people need to be fit tested for those and use the right mask that fits their face. And to make things even more complicated with the N95, those sizes are not standardized among all N95 makers. So if you used a particular manufacturer, you might fit a medium, but a different N95 manufacturer, you might fit a small. So for those reasons, a standard mask or face covering is preferred.
Thank you very much, Dr. Weber. Could you speak to this mask that's been issued by the schools? How effective is that?
So again, these are fabric masks. You can notice the importance of the loops that go behind the ears, I should say, for people who have particularly small faces. If they're very loose on the sides, you can either tie a knot at the end of the loop or sort of twist it once into like a figure of 8 and then put the outer opening of the figure 8 over your ear, and that'll tighten them up a little bit. As was already mentioned, they need to go over the nose and down below the chin. They are very effective, and they are designed, as we talked about, to be cleaned. And ideally, it's best to have actually 2 of them, so you can clean the one you use that night, and you don't have to worry about remembering to put it in the laundry and dry it, etc., and just switch masks daily. But otherwise, you would want to clean it. And it will not affect the filtering capacity one way or another, the cleaning. But what it does do is remove any viral particles that might be on the outside of the mask.
Great, thank you.
I think that there was a question from the chat about some masks are nylon and very thin, and what kinds of masks work best. Although I think this is probably best a topic that we cover in detail in a future webinar. Maybe Dr. Akinboyo, if you can touch briefly on the vocabulary around the different types of pictures, different types of masks that are in the pictures on the left-hand side as we look at the slides. And then we can touch on this topic briefly and maybe do a follow-up to some of these questions in a subsequent webinar.
Yes, I can. And I think Dr. Weber and I can likely tag team on just determining what works best, particularly with thinking about different materials. So we referenced one study that has circulated quite a bit and had multiple headlines come out of it that may have changed what the actual outcome was from the study. But without belaboring the point here, I think what's helpful is it goes through multiple different types of masks, starting from number 1, which is the surgical air loop mask that most people are comfortable or have commonly seen, to a number of different materials that I used to make masks, including mostly cotton and then a few that were this poly blend type of material. And then as you move further on, sort of the bandanas and the neck gaiters. I think in this context, if you look on the graph on the right, it has fleece on the x-axis there to the far right, but we're discussing with the authors what they actually meant. It wasn't fleece material. The brand name was called fleece, but it's a material that it was made of, I think, of spandex and polyblend or something like that. So the point here is it's hard to measure and figure out what the best material is to make a face mask. I think right now we're still in the United States where we're trying to just make people or encourage people to wear some kind of face covering. So any face covering is good. However, what they were measuring here with just comparing how much droplets kind of seep through. If you wear something that's relatively thin and it's one layer, as just thinking of putting water on it, you would expect that water will go through fairly easily. I think a double layered polyblend, most of the masks I've seen, fabric masks are made of those types of materials, are fairly useful and can prevent enough droplets to protect against spreading or acquiring COVID-19. I don't want to belabor the point, as you mentioned, the specifics of the materials we have to spend more time talking about. I know we have a number of questions to get through. I just wanted to share and have people get familiar with the different types of masks that may be in circulation. Opt for cotton-based or polyblend, so just at least 2 layers, and something that you would actually wear, be comfortable with, and can stay on the face. I think those are the goals. Dr. Weber, did you want to add something here?
Thank you. I think the key things to any properly fitted mask are as tight a fit over the nose and chin, around the face as possible, and a material that's thick enough to do filtering. So quilted cotton is an excellent use of material.
Great, and I'll add to that. You know, when we're seeing patients in hospitals, and we're very close to them because we're doing physical exams and we're talking to them oftentimes for a prolonged period of time, our patients will have on these cotton masks, these cloth face coverings, and as physicians, we're wearing masks that Dr. Akinboye showed us earlier, the mask that is in box 1 there, the medical masks. And we really are seeing very few transmissions around the hospital setting or within the hospital setting. I think Dr. Weber told us on Wednesday night there have been none at UNC Healthcare. Is that am I still quoting you correctly on that, David?
You are. We've taken care of many COVID patients, and when we do cough-inducing procedures, which they don't do in schools, we do wear an N95. But for all the rest of our care initially, we've been doing surgical masks, and we take care of people who are initially rule-outs for COVID, and we've not had any transmission. Furthermore, there's a very nice study that was published in China where they had a COVID-positive patient in a multi-bed area in the hospital, and all the patients and all the doctors were wearing just wearing medical masks like these, and not a single other patient or a single physician acquired COVID, suggesting, and there's much evidence that masks really do work, but one, they have to be worn, and they have to be worn by everybody. It's particularly important for the people who are infected, even if they have no symptoms, to wear a mask, because that prevents expelling infectious particles.
I think this is a follow-up question around the washer-dryer sequence. So Dr. Akinboye, I think I'm going to send this one over to you. It has been suggested to me, I'm paraphrasing, it has been suggested to me by my sister-in-law to machine wash my mask and not put them in the dryer, but rather to allow them to drip dry. Do you have a comment on that?
Yes, and I'll try and I know we're also keeping track of the Q&A and the chat, so there may be some questions that cross over. So just some quick rapid fire answers on masks. So if someone takes it up and hangs it on a lanyard, I think someone had mentioned, or hangs it on something else, it's probably fine. The goal is to not have it dragging all over the place to try and limit that from happening or having other people touch it. If you are washing a mask by hand, a fabric mask, I think the CDC currently recommends using a bleach and water solution. I think the idea is you may not necessarily use hot enough water. So bleach just helps with doing a brief disinfection as you're washing it. If it's in the washer dryer, that should be hot enough. You can wash it with your regular load. You don't have to do anything special, and it should be hot enough, or whatever that wash cycle is should be appropriate to get that clean. As to where to dry, most often, particularly to maintain the integrity, it's a small item, hanging to, sorry, I lost audio there for a second, but hanging to dry is fine, and I think that will help to maintain your mask integrity long enough. There was another mask question. I may have lost track. There are quite a few questions floating around, but we can either address it now or kind of when we get to the Q&A.
I think you addressed it around earlier. It was around the thinness of the nylon, and again, we can go through materials in more detail at a subsequent webinar, because I know Dr. Weber and his team at UNC have done some nice work testing various masks. There were 2 questions that I think will defer. One question that I think will defer, which is about checking out books for remote learning. I think we'll touch on that in a subsequent webinar that looks at indirect transmission by touching, and if that's possible and how. And then there's a question about colleges, and I've got to tell you that as inpatient physicians and outpatient physicians, we've got our hands full with the K through 12 environment. We won't be addressing what the colleges should or should not be doing on these webinars. There's a follow-up question, and I suppose this can go to either Dr. Weber or to Dr. Akinboye. Why don't we hear from Dr. Weber? David, is it safe to leave your mask in the car?
So the answer is yes. I mean, the heat of the car, even in the summer here, isn't going to damage most mask material unless it's some type of polyester that has a low temperature tolerance. The way if you're going to put the same mask on, the process is fairly straightforward. Whenever you touch your mask, before you do it, you should wash your hands for 20 seconds in soap and water, or use an alcohol waterless product for 5 to 10 seconds, like Purell as an example. You take your mask off and you fold it so the outside of the masks are pushed together, the theoretically contaminated surfaces, and the inside facing the skin is now outside. You can just drop it in a paper bag or a plastic bag. We give out just the standard little brown lunch bags there. Let it sit for whatever time you need to. And then you do hand hygiene when you put it in the bag. When you're ready to wear it again, hand hygiene, you pull the mask out, unfold it, put the same side that was touching your face before on, and then you do your hand hygiene again. And that would work perfectly well. And there's no reason, again, unless you have a very temperature sensitive polyester, about leaving it in the car, as long as it's in the paper bag and not, bouncing on the seat, on the floor. You wouldn't want to then pick up a mask that was on the floor of your car and put it on your face, not worrying about COVID, but just all the other grime that might be on the floor mat.
Great, thank you.
There was also a question about the mask getting wet, a cloth mask in particular, and whether or not you should be changing that mask if it's cloth and it gets wet during teaching. Dr. Akinboye?
It stands to reason that if the mask is wet and you have another one, it's worth changing. And I think some of that has to just do with comfort. You certainly don't want to just have some wet thing on your face that may reduce the chance that you keep it on. And then also, we don't really measure the usefulness of masks when they're wet because everything is soaked through and they may just keep absorbing. As to how wet that is, I think that's hard to answer. But if there's a lot of sweat or if it's just wet with other things, then it's worth just removing it. And so I guess it reminds me that having an extra one, particularly if you're leaving the house and you're going to be out for hours, is probably a good idea. And I think I was trying to keep up with the chat. There was also another question about what to do with children or even adults that may have some sensory issues or tactile issues. I think this is where the material comes into play. What would be most comfortable, what's soft on the skin may be the best approach. And in those settings, sometimes instead of a loop, some people have offered to use ties just because it helps it secure the mask on the face, but it's less restrictive when you're wearing it.
I think the adaptive approaches to the children taking the adaptive curriculum is a topic that we should explore more closely and more thoroughly in a subsequent webinar to collect those questions systematically and address them systematically, because we've been getting a lot of those. There's a question about an air purifier or HEPA purifier, and those types of questions we'll do in a subsequent webinar. Are there any additional questions that Dr. Zimmerman from the chat or that folks want to type into the chat? Kenesha, are there additional questions?
There was one specifically about the white mask that the district provided. I believe, Dr. Weber, you initially spoke on that. The question was specifically about bleaching that mask, and would that help to reduce the germs?
So bleach is an enormously effective disinfectant, rapidly kills not only COVID, but virtually every human germ that causes disease. And for cotton fabrics, it won't hurt the fabrics. Obviously, if you're using a colored mask, depending upon what it's made of, as you know, cotton can bleach those, but in general, it's not going to actually harm the fabric itself. And so small amounts of just standard bleach, diluted 1 to 100 or sometimes would actually be very effective and can be added to the washed water.
Thank you. And then there were several questions about social distancing in circumstances such as playing games with like board games or at lunchtime. I believe there were some others, but can you just talk about whether or not there might be certain specific circumstances in which you might be okay or not with people not being socially distanced? Is there any nuance regarding what they're doing? Dr. Akinboye?
Possibly. I think we may have to discuss some more about that. Oftentimes, if it's outdoors, if there's not a lot of yelling and singing, then they're not expelling as much. If it's indoors, it probably is best if there's some type of face covering that's included in meeting indoors, at least right now. And it goes to another question that was in the chat, which is, if masks work so well, why can't we all just gather willy-nilly at this point, or to an extent, just have school in person? And I think it's partially because it's more than just masking. As a community, we need to get our levels low enough that even when we start to regather in whatever setting, the number of people that are infected in that close setting are low enough that even if somebody is not as compliant with their mask, we don't see infections happening. So we still have a little ways to go with reducing our community prevalence, and masking is one part of everything else. So there's a lot more, including just distance, staying home while sick, and cleaning our environment, all of the things we'll talk about as we go along.
Great. So Dr. Akinboye, the concept that I hear a lot in public health settings, if you could reinforce this, because you started to touch on it just in that response, is the concept of a bundle. That is, when we do public health intervention, we often bundle several interventions together. And it sounds as though masks are a key part of the bundle, but not the entire bundle. Can you help describe that maybe a little more detail and a little more artfully?
Certainly. I think as we understand more and more about how COVID-19 spreads, we realize that a face covering or a mask can reduce infections, but a mask by itself is not sufficient. And that may explain why you hear about some cases where someone attests to wearing a mask the entire time and yet still acquired COVID or still got COVID-19. I think it has to do with what we do with our environment, so ensuring we keep a clean environment, making sure that we're keeping some distance, and making sure we're not having other unmasked exposures. So in one setting, you may be masked the whole time, but you leave that setting. So for example, I'll bring it back to the hospital, where with our patients, most healthcare workers are wearing a mask the entire time, but oftentimes we're a little more forgetful when we're interacting with each other, or we're in smaller settings where we contaminate our environment. So I think we think of preventing infections as a coordinated effort. It's never really just one thing, and it involves multiple layers to block that Swiss cheese model. So you don't want all the holes to align. So if you can just block it at different points, then you reduce the risk enough that you can continue on with our regular lives.
Great, thank you. So I think we will cover, there's a question about eye coverings and their importance, and we're coming up to the top of the hour. So in order to be respectful of everyone's time, we'll cover or we'll deal with eye coverings when we take on the topic of shields in a subsequent webinar. Now, it'll be very helpful to Dr. Zimmerman and to me as the co-chairs, as well as to our panelists, if the teachers, the staff, the school leadership, the superintendents, if over the course of the next few days, if you can give us your feedback to your school leadership about the helpfulness of the format and the question and answer format and the presentations that we've provided, because we want this fundamentally to be a service to our community. And with that, Dr. Zimmerman, I believe you have the last word this evening.
Sure. I wanted to extend a big thank you to our superintendents who are here, Dr. Kathy Moore, Dr. Jim Cosby, Dr. Pascal Mubinga, and then representatives from Orange County, Ms. Penny Rosser, and Ms. Diane Rucker. Thank you very much for joining us and for asking questions from your districts, and we certainly want to continue that going forward. So as you get them in, bring them to us, and we're happy to try to answer some of those. I believe also, Dr. Akinboye, you had a couple of take-home slides that you'd like for people to see. Do you want to finish those up?
Yes, I think it's a public service announcement. We can't leave without just chatting about immunizations. And they're just routine immunizations that kids should already be getting, including the influenza vaccine. We talk a lot about COVID, but we have safe, effective vaccines that work. And so it's just important in your own social circle to just encourage people to get vaccinated, particularly this season. And as we are moving forward and learning more about the use or the impact of vaccines, I think we can have a dedicated session to talk some more about this and address any questions that come up. But just lots of thanks to all of you for listening and for having us here and putting a plug in for getting vaccinated.
Thank you. I hope you all have a great night. We will answer these questions either in the future webinar or in written and get that back to you guys.